Health now, and Kenyans will have to live with a biting shortage of blood in hospitals across the country for some time as the Kenya National Blood Transfusion Service races against time to revamp storage capacities in its centers across the country. Kevin Ogutu brings us the story of blood shortage, even as the transfusion service claims the blood collection in this quarter has more than doubled that of last quarter.
30-year-old Caroline Auma, a widow, leads me to her son's 4-month-old grave right behind her house. This is where 11-year-old Victor Ouma was laid to rest in December 2020.
Atere katito no yudo ka dakteche ogomo. Koro atere private, koro ka atere kuro to yud ni pime to yud ni remo rumo. Koro ka remo rumo to aduogo kode anyiewo ne yath remo go. Abiro kode dala kae. Koro namiye yedhego to yedhego naneno mana ka olone medore.
In September last year, she took him to Ahero Sub-County Hospital for a blood transfusion, but 2 months later, the boy became sick again. This time round, there was no blood, and they were referred to Jaramogi Oginga Odinga Teaching and Referral Hospital. But there was no blood in Nyanza's largest public hospital.
Koro remo ne onge, wabet kwarito remo. Koro ngiswa ni wadhi dala. Koro emo duogo dala kae dwe mar 12. Ma wabudho kode dala kae emo thae.
Her 16-year-old daughter could have suffered the same fate. Now a mother of a 5-month-old infant, it took the intervention of a child protection volunteer, Jacqueline Atieno, to save the minor who sat the just concluded KCPE exams. With the doctors in Kisumu on strike, she was taken to Vihiga. At Kisumu Regional Blood Transfusion Center, the staff are busy with their work. However, the empty trays in this cold room is an indication that it is working well below its capacity.
For the past 1 month, it has been a challenge for us to get blood. We've been relying on relative replacement, but sometimes we go out. We were going to Maseno University to collect blood, and also we organized blood donation at JTRH.
At the time of this interview, the facility had only 72 units of blood.
As much as corona is with us, the sickness or accidents or maternal mortality does not stop.
In many cases, it leads to death. Death of people who have been in road accidents and you cannot transfuse them. Death of women who are pregnant or are in childbirth and they need blood and you can't transfuse them. Those are the kind of deaths. And also children and adults who have low blood levels due to poor nutrition, and you need to give them emergency replacement of blood.
Tuwe na ile tabia ama culture ya kuwa tunatoa damu kila baada ya muda, because kila tukitoa damu itakuwa sasa ni kama unajisaidia wewe mwenyewe, kwa sababu haujui nini itatokea kesho ama mtu wako. But muhimu pia tunaweza kufanya vipi ili tutengeze zile sehemu ambazo hizi damu zinawekwa, kwa sababu utapata hizi sehemu pia huwa zina changamoto nyingi, na ni kwa sababu ya ile ufadhili aidha kutoka kwa serikali ama hata watu wa kibinafsi. Nafikiri ni muhimu tuanze kuiweka katika ile mipangilio yetu.
Dr. Nduku Kilonzo, the director, Kenya National Blood Transfusion Services, told KTN News that they are revamping storage capacities in terms of fridges and freezers in all the regional centers. She also said that renovations are ongoing to address the infrastructural challenges that have been there in the past. KNBTS has been engaging counties in terms of areas of support since transfusion is a county function. Kevin Ogutu, KTN News.